One of the things that we've increasingly within medicine grown aware of is that patients are different, that we can subdivide the human population, that's any population with disease or without, into subgroups. One of the key things is that there exist patients with rare disease that have mutations, so genetic illness that affect specific immune pathways. So my research has focused on what we can learn from the immune response in patients who have disruption of immune pathways that could lead to autoimmune disease or could lead to immunodeficiency. What can we learn in terms of their response to COVID and COVID vaccination, and how can that help us in understanding what pathways are really important for either better vaccines or better protection against COVID-19. We've identified a specific cell type that is expanded that inhibits the vaccine response in these patients, and that cell group are termed age-associated B cells. So these are the specific cell type that are found in elderly people, but more commonly pathologically associated, expanded in patients with autoimmune disease. Now these cells have been shown to have a reactivity against self that can make a significant contribution to the autoimmune disease that the patients are suffering from. That correlation between age-associated B cells and disease, in our research and research by others around the world, is actually pointing to this being a causative cell type. And that means depleting this cell type might prevent disease. Now, one of the big things is we've got existing therapies that target B cells that make autoantibodies, but these therapies in some patients don't work effectively, and even when they do work, leave the patient at risk of autoimmunity. If we can target specifically the subset of B cells that cause autoimmunity, maybe we can get selective targeting of the cell type that causes the disease without leaving the patient immunodeficient. The Medical Research Foundation's award of this grant rubber-stamped my career at a key bottleneck for most researchers. That point when you break through to independence, and it allowed me both with the funding and the science that it supported to actually enter a field which was rich for scientific development in translational research that may benefit patients.